Hi, my name is Jenny Hatter, and I'm going to be presenting on a topic titled New Graduates in the Emergency Department. Could you, would you, should you? In the introduction, we find that although newly graduated nurses have been taught technical skills to care for their patients, they often lack experience. And this is a problem when working in a fast-paced environment such as the emergency room. And we are also going to talk about some other issues where this might come into play. Qualities that every emergency room nurse should possess, first and foremost, would be sharp assessment skills. The nurse needs to know how to ask the right questions in a patient interview. It's important to get proper information and a thorough history. When a patient is coming in for an illness, we need to know exactly what it is that's led up to that problem so that we better know how to treat it. We need to perform proper physical assessments and then document all the information properly so that the rest of the staff knows what is going on with this patient. Next would be the ability to work at a fast pace. There are some jobs in nursing where you don't really have to work at such a fast pace, but in the emergency room, that is not the case. The patient load and patient situations are highly variable, and the nurse must be able to adapt quickly and make prompt decisions at times. The next qualities would be the ability to work autonomously. ER nurses must be able to work with little supervision and be able to make quick and competent decisions. When you are working on the floor, you have other people that you can ask for help or opinions, which in the emergency room sometimes is not feasible. You may have a patient that is a trauma situation, and the nurse needs to be able to decide quickly what is the best route to take care of that patient and wouldn't have time to ask someone else what to do. So it's very important that he or she be able to work autonomously. It's also important to have strong critical thinking skills. They must be able to think quick on their feet and think one step ahead of the situation. When a patient presents with a problem, we need to be able to think about what could potentially happen that could stem from that issue, and therefore be prepared for anything that may happen as the result of what they're presenting for, anticipating events before they happen. Now, it is also important that the emergency room nurse possess some personality characteristics. One would be good coping skills. In the emergency room, it is typically when patients are at their worst that we're seeing them. It is important that the nurse knows how to deal with difficult people and know that not to take those things personally. We're treating the patient and not their personality. It's also important for us to stay calm in an emergency. Lots of times if someone is upset, it's easy to get upset yourself. The patient will look to the nurse and the physicians and any other medical staff to know how to react about their own situation. And we also don't think very clearly when we are upset, so we need to stay calm. It's also important for the nurse to be assertive, not aggressive, but assertive. We need to know how to get the patient to do the things that we need them to do to take care of themselves. We also need to know how to communicate to other medical staff in such a way that we're going to get the things done for that patient that need to be done. And it's also very important to have empathy. This is different from sympathy. Sympathy is feeling sorry for someone, but empathy is where we would know that we can relate to that patient or try to relate to that patient and understand what it is that they're going through. If we don't understand it, we can do the best of our ability to know that they are not feeling well and we need to give them the attention that they need. There are also many responsibilities that go along with being an emergency room nurse. Central to all of this is communication. We need to be able to communicate with our patients, and we need to be able to then communicate with the physicians that are caring for them. Lots of times we need to communicate with the family. They need to know what's going on with their loved one, how to better care for them. And we also need to be able to communicate with other medical staff or insurance companies, secretaries. Really, the nurse in the emergency room is the advocate for the patient. This is the person that works most closely with the patient, and this is the person who also relays a lot of information to the other medical staff. So it is very important that the nurse be able to communicate well. It's also important that the nurse be able to multitask. As we mentioned earlier, the emergency room is a very fast-paced environment, but we also need to be able to handle multiple patients at one time while performing patient interviews, assessing patients, being able to document and chart, being able to set up and maintain medical equipment, passing medications, etc. We need to be able to be flexible and be able to perform all of these tasks for a multitude of patients throughout our shift. It is also important to manage time wisely, using our downtime to do things that we wouldn't have time to do when it's busy, such as charting, such as stocking up medical equipment, or things of that nature. It's also important to know how to triage patients and prioritize them. There are some patients that come into the ER for colds or something of that nature, and there are other patients that are coming in as a trauma situation where they are critically ill or injured. And so obviously it's important to know which patients can wait and which patients cannot. It is also important to continue your education. This is a requirement for nurses, but there are also some education seminars and things that a nurse can take to improve or sharpen her skills that are not necessarily required. But it is important to keep up with the latest medical information. And next we'll talk about how the research article that I chose to study was on how to assimilate new RNs into the emergency room. This study actually was in Charlottesville, Virginia, and they had a regular hospital where they decided they were short-staffed, and they had a program that was 6 months long. It was an internship that trained the new graduate RNs to be emergency room nurses. And during that time, they went through and worked in the ER for, like I said, the 6-month period. They were followed by preceptors and learned additional training. The desired outcome of this program was to turn new green graduates into competent and confident nurses. The components of the program were general orientation, clinical rotations, clinical support, didactic learning, and core learning. The internship program results were good. The graduates of the new emergency department graduate nurse internship program were found to have measurable core knowledge and skills that are higher than that of new graduates on other units because of the comprehensive program components. So in other words, these nurses, although they had their general clinical knowledge, their general technical knowledge, they were able to get into the actual workforce hands-on for 6 months, which is not feasible when you're in training as a nurse, just to get your degree. So experience means everything. And they have found that they've been able to maintain their staff and didn't have such a high turnover. So the conclusion is, it's evidence that new graduate nurses do lack the skills and competence needed to specialize in the emergency department right out of school. But programs such as the Emergency Department New Graduate Nurse Internship Program help develop the skills necessary to be successful in the emergency room as a nurse. Thank you for listening, and I appreciate it.